if people could put their cities with their names, if you could rename your Zoom, that would be great. And then if you're not, I think Faye probably will, or Alex has muted all of us as we go through the speakers, but then we can unmute. It's a small enough group. I'm sure we'll be able to unmute for questions and conversation. I think we can just get started, Faye, and then people can.
Yep, that sounds good to me. Kathy, you want to kick us off and I will go through your slides?
Sure. I think the first slide, welcome everybody. We're very excited to be able to share these, the work that the local folks have been doing through our Robert Wood Johnson grant, which has a very long name, but basically it's using data to advance equity in COVID. And we'll be putting links in the chat that tells their stories and to our Medium blog later. If you want to start, I'm starting with a plug on camp tomorrow. So we didn't get an overwhelming number of options, but we wanted to get a poll for people to see if they did plan on coming tomorrow, what they would attend. So if Alex, can I launch the poll?
Yeah, either way, I can launch it right now.
Okay, poll 2. Yes. So so we have 2 rounds of camp sessions. You can see the piece here. One is following up on our first speaker on community conversations on algorithms and automated decision making. Michael Cohen will handle that. Laura McKernan has posted one on external communication. So this includes like social media, newsletters, video, lots of things. There's an evictions one that Jordan Aya from Kansas City will lead. And then I would just say if there's another topic, including childcare or food security, but others, you can put it in the chat if you have other topics that you are wrestling with right now. So that's round 1. Oops, round 2, which I has a typo. So number 2 is about round 2, despite the question title. Sarah J. from Seattle would like to talk about how to integrate quantitative data with sort of qualitative and photo content for more compelling stories. Erica Raleigh from Detroit. They've been working on a data maturity model for nonprofits and want to think about their offerings for nonprofits at different levels. Whoops, Latanya's leading evictions, Leah says. And she's from Durham, also doing great work on evictions. I am leading one on criminal justice reform. We've seen a little bit of interest in that in policing in particular. Leah is going to run countering bias. So many of you have experienced that people are waiting for experts to come in from out of town to tell you smart things instead of relying on local analysis. So doing some strategizing around that. And that's round 2. And this is, since it is camp, yeah, more topics are welcome. And we might think of more overnight, depending on how creative we get. Did you think of another one, Leah?
Oh, I just had another example of people wanting out of town folks to do local work today.
So anyone else? Okay, you can end the polling. This gives us a sense of basically equal all around and no additional and then we'll recruit people for Erica's, I think, separately. Okay, great. Oops, I should share the results, huh? Share the results. We had not very many people voted, but it's still helpful to get a distribution for us as we think about the breakouts. Okay, stop. All right, next slide. Just a plug for the events coming up there's camp tomorrow, and then next week is our last week of NNIP month. Time flies so quickly. We have NNIP Showcase, which is some fast presentations from NNIP partners. We have a fantastic panel with representatives from the Kresge Foundation, JP Morgan Chase, and a local foundation, Richmond Memorial Health, that will be talking about sort of trends in philanthropy and what it means for, and for us to ask questions about what it means for our work. And then we put aside some time for small group lunches for whoever wants to join on Thursday. And then we'll send the mechanics out soon. So that's all I had.
Great, thank you, Kathy. Thank you all for joining us today. My name is Faye Walker. I am a research analyst at Urban. Some quick kind of overview of what to expect and housekeeping. We're going to speak with the panelists, with the grantees for about 35 minutes. And then we're going to do about 20 minutes of Q&A. So if you have questions as we are going through, feel free to drop those in the chat and we will compile them. And then we'll start off with those and refer to those. But it's also a small enough group, like Kathy said, if when we get to the Q&A, you want to just take yourself off mute and ask your question, then feel free to do that. So today, just a little bit of overview, like Kathy said, about the grant. There was 17 grantees across the country, and these grantees were tasked with working with local partners, collecting local data, kind of building local data capacity, and they really covered a wide array of topics. There was some grantees working on transit, some working on social services. Our two projects today are focusing on access to food and on childcare. So today we are going to be joined by Rob Fisher. He's the co-director at the Center on Urban Poverty and Community Development, and Debbie Foch, who is the assistant director at Starting Point. So they are joining us from Cleveland. And then we're joined by Katie Wang, who's the program manager at the Kinder Institute, and Paula Balbotin, who is the program and development manager at Urban Harvest. So they are our Houston teams. We'll also going to be joined by Elena Sorensen, who's also at the Center on Urban Poverty in Team Cleveland. So she'll be jumping in for the Q&A to help support with some answers there as well. So we want to just kind of start off before we launch into the actual discussion. We want a little bit of information about what all of you all are doing. So do you all currently have data on childcare, food security in your portfolio? We're kind of curious about where people are coming from, what data they're looking at. So we'll give everyone another 30 seconds, another minute, and then we can end the poll and launch into the projects themselves. Perfect. So yeah, we've got an interesting split here. We've got about half of you collecting data on both, about a quarter saying neither, and then about a quarter saying some on food security but not childcare, and then less on childcare but not food security. Cool. So that is an interesting and good place for us to kind of start off. We are going to start by exiting the screen share. And then just kind of saying, can you all start by talking about what you each found in your respective cities through the grant? and what case you would make for other data-focused organizations to dig into issues related to food insecurity and childcare. So we'll pass it off to Cleveland first.
Are we going to stop the screen share? I don't think I can share without at the moment.
Yes, sorry, 1 second. I'm just trying to get back to the regular Zoom. The actual full Zoom went away, but saying, stop. Saying this, is the share, like, can you still see the PowerPoint? Is that?
Yeah.
Okay.
Oh, there we go.
There it is.
That's
okay,
it.
Great. Thank you.
Super. All right, great. Well, thank you. Thank you for the invitation to be here, and we're pleased to share our work along with our colleagues from Houston. I'm Rob Fisher at the Poverty Center at Case Western Reserve University. And when we saw this announcement, the format was to nominate a local nonprofit, and we immediately thought of a partner of ours over many years, Starting Point, and Debbie Fodge is joining me today for these comments. Thinking back to last year, we had immediately kind of reviewed what systems were being impacted by COVID, and one of our first thoughts was around childcare, because we were well aware of what was going on with closures and the impacts. And so as we thought about this opportunity, we really wanted to bring together data, some different data than we had in the past. And we wanted this to be framed as, how could we best serve up data that could inform Starting Point and other partners working in early childhood education in Cleveland and Cuyahoga County. So we drew on really 3 different data sources. One was a special capacity vacancy survey that was fielded by Starting Point. We also have an integrated data system for Cuyahoga County that's hosted at our center, which brings in data from about 35 different entities that share identifiable data with us. So we're able to look at multi-system involvement for primarily children, but also families. And then we also wanted to bring in local employment dynamics data from the census to specifically look at characteristics of workers at the neighborhood level, thinking about essential workers and their needs for childcare, and also disadvantaged workers, low wage workers, and how their needs for childcare might be impacted during the pandemic. So we convened an advisory group to kind of get their best thinking. This was a very short window, really 4 or 5 months to get to the product. So we rapidly did that. Starting Point really pulled off an amazing iteration of this survey. So they did all the direct contact with the programs, not only asking about how many kids are currently at your site and how many slots do you have, but also about the impacts of the pandemic on their services. And then we at the center, and Elena, who's on today, really did all the hard work of bringing those data together. And our normal reflex would have been to create a big report, but in this case, we decided we really wanted something that would be community facing and much more accessible. So we created this interactive story map, and I'm going to just you can certainly look at it, encourage you to on your own time, but we tried to make it a really interesting and engaging presentation of the data. So you can just see kind of a visual in the lower part there, just showing the locations of both childcare centers, but also we have a lot of family childcare homes, which serve up to 6 children. We have all the data from the provider survey. So you can see in the upper panel how many programs were actually closed or opening at reduced capacity. In Ohio, the governor approved a plan to let childcare centers operate at about half capacity, and still be able to draw down an enriched per child daily rate. So that was a kind of logistical decision that many centers faced, and many did choose to open at reduced capacity. Though you'll see the family childcare homes bar, most of them stayed open as regular business because they were already small numbers of kids together in those homes. In the lower panel, some of the survey data, you can see that, lots of impacts on these programs from the pandemic. In general, the impacts were much more severe for those childcare centers as compared to homes, because they were facing the issues of having to reduce their capacity to limit the spread of COVID in their environments. So, the kind of the big takeaway was, yes, like so many industries in most communities, they were hard hit, both in terms of how many kids were in those programs, but also how much capacity they were maintaining. And some of them obviously were reducing capacity because they didn't need it. In the lower panel here, you can see a couple examples of maps. So we compared 2019 data to 2020, and you can move that bar back and forth if it was in the interactive version to show you at the neighborhood level how both enrollment and capacity changed between that 1 year period. And then there's another one that shows kind of the dividing enrollment by capacity, so percent enrolled. We also use those LED data to kind of look at the characteristics of workers in the neighborhoods. So we did both kind of aggregate for the county, but then for every municipality, we did a kind of a more narrative handling and data specific to each city, in the hopes that people, because childcare is a local affair for the most part, and it really, the data changed quite differently even between neighboring neighborhoods, adjacent neighborhoods. So presenting it that way allowed people to go in, look at their community and see what was true. So this is just unemployment data. I'm going to skip ahead. We were very delighted that we got nice coverage of this work when we released it. Although you'll see in here things like ravaged, COVID has ravaged new childcare deserts in Cuyahoga County. So they really focused on trying to make it sound very dire. And luckily they did interviews along with the data, and many of the childcare operators were able to provide some context about how some of the numbers might look dire, but they're reflective of kind of a dip in practice, which is needed during these times. So I think I'm going to stop there. I hope I didn't go too long, and stop share.
That's great. Thank you.
So are we going to switch? We're going to switch to Houston now and get their basics. Okay.
Yeah.
Great.
Then
Thank
we
you.
can dig in a little. So same question passed off to Houston, kind of general findings, making the case for food insecurity data.
I'll go ahead and share my screen.
Great.
Everybody see that okay? Great. Okay, yeah, so first of all, thanks to NNIP for facilitating this panel and also for being innovative while we're all virtual still and doing the whole NNIP month thing. We're grateful to all of your coordination for that. But yeah, I'm happy to share about our recent project with Urban Harvest that was also part of this Robert Wood Johnson Foundation initiative. So between July and December in 2020, we collaborated on a joint effort with Urban Harvest, through which we created what we called our data-driven decision support tool that would help Urban Harvest ensure equitable access to healthy and affordable food in the Houston region, especially during the pandemic. So I'll give you a quick bit of background on the programs that served as the foundation for the project, and Paula can certainly elaborate upon these later if you have additional questions about them. She knows everything about everything with Urban Harvest's food access program. But Urban Harvest facilitates the Double Up Houston program, which is a SNAP incentive program that gives Lone Star or EBT card users a 50% discount on produce at participating farmers markets. And then in early fall of 2020, Urban Harvest launched its mobile market, which extends the reach of the Double Up program and creates new pathways to healthy food for community members who are facing new and perhaps heightened food insecurity during the COVID-19 pandemic. So it was the latter resource, the mobile market, that was really the focus of our collaboration, as Urban Harvest kind of faced the question of where to send it in the midst of the pandemic and heightened food insecurity among Houstonians. So we knew that there was some significant need. We examined several different data sets, including 211 data, for example. And in early March of 2020, the number of food-related 211 calls saw a nearly 15-fold increase and remained really far above pre-pandemic levels during the ensuing months. So that was kind of the food security context, if you will, that we began our collaboration in with Urban Harvest. So like I said, with funding from the Robert Wood Johnson Foundation, our goal was to create a tool that would help Urban Harvest develop an evidence-based strategy for its mobile market. So the primary questions that you can see down here on the bottom left were, where is food insecurity concentrated in Houston? And in turn, where should the mobile market go to best meet the needs of those food insecure Houstonians? So to do that, we started by reviewing and analyzing administrative data from the Double Up program that Urban Harvest team provided. You can see that there on the left. And we specifically looked at the vendor reports and customer reports to get a basic understanding of who was using the benefit and how. And I should add that we did specifically focus on sites in Urban Harvest's 4 priority areas, which they had identified previously for their own programmatic strategy. And those sort of arc from the northeast section to the southeast section of inner Houston. So that was sort of the geographic concentration for our project. Our Kinder HCDC team brought quantitative data into the picture, including secondary data like pandemic EBT users, the percent of households using SNAP, the percent of households without a car, etc. And then we jointly designed 2 focus groups with SNAP users to gather information about their decision-making related to accessing food for themselves and their families, their shopping habits and preferences, and the barriers that they experience when they try to get healthy food. And the qualitative data from those focus groups, together with that various quantitative data that each of our teams contributed, became a really rich body of information that we built into a data decision support tool, which included map layers that show the locations of potential partners for Urban Harvest and the locations, potential locations for the mobile market. And then in addition to that, we also used the data we collected to outline a mobile market outreach strategy for Urban Harvest's team. So we shared that with Urban Harvest leadership, and that's really meant for internal use. And here's just a more visual representation of all of the stuff I just described. So on the left, you can see Urban Harvest dashboards containing the administrative data that we initially analyzed. And again, Paula can elaborate on how Urban Harvest collects and maintains that kind of data if folks are interested in that. She's the one who manages all of these Tableau dashboards, which is really great. And then on the right, you can see the map layers with secondary data that Kinder HCDC created. I'll show that again in a minute. And then in the middle, you can see the products that resulted from and kind of added to this synthesis of data. And those again included a summary of the qualitative data we gathered through our focus groups, as well as that mobile market outreach strategy and ideas for potential mobile market sites. So I do want to very quickly highlight some of the focus group findings because that was a really important piece of our project. So we conducted 2 focus groups in September of 2020. One was in English and one was in Spanish. And our Kinder HCDC team helped design the participant screening survey and crafted the focus group protocol based on a literature review of similar efforts and endeavors kind of across the country. And then a couple of Urban Harvest collaborators, including the Houston Food Bank and El Centro de Corazon, which is an FQHC, helped recruit eligible participants for these focus groups. So that was a really helpful part for us. And so all in all, we had 12 participants, and nearly all of these are active SNAP users. And then during our conversations, focus group participants presented some common themes about what kinds of locations might be really successful sites for the mobile market. So the most prevalent suggestions included K through 12 schools. That was kind of the highlight that we got from a lot of the focus group participants, and several specifically mentioned connecting with HISC wraparound specialists in particular schools. And then several participants recommended community centers. That was a big one. Several offered churches as potentially successful sites. Others mentioned parks, grocery stores, benefits hubs like WIC offices, and more. And then we also gathered insights again related to messaging and marketing that we shared with the leadership team at Urban Harvest. So we incorporated all of this feedback as well as that secondary data that I highlighted before into the final version of the data decision support tool, which you can see here. So this is a screenshot. You can see the subjects of the various layers here on the left side, and then as they appear in the tool over here on the right, where you can check them on and off depending on what sorts of data you'd like to see overlaid and grouped together depending on what kind of question Urban Harvest wants to ask. So the product of the collaboration was really this rich visual landscape that Urban Harvest can kind of explore and reference as it decides how to manage its mobile market and partner with organizations in its target neighborhoods, which you can see here actually outlined in blue. So I think it's important to note that Urban Harvest has built the internal capacity to maintain and update this tool so that it's really a living resource that Urban Harvest can use indefinitely, kind of as it makes decisions about its food access programs. And Paula can again speak to how Urban Harvest is using this resource beyond just the mobile market and double up. And we can get into that in a second. But that is our description. So I'm going to stop sharing.
Perfect. Thank you all. Thank you for providing that context. I guess the next question would be, can you all speak a little bit to the collaborative research process, kind of what makes it work? How is it different in times of crisis? And how are the research projects and the products that you're coming up with different when they're collaborative? And we can pass it back to Houston to start off here.
Okay, I think I'll go with this one. So, well, as part of this collaborative research process, we also met with Katie to brainstorm about what should be the answer for this. But so I will kind of like go one by one explaining. So I think one of the main ones was a kind of like one key component was having a pre-existing relationship and trust. I've known Katie for just less than a year. I came into Urban Harvest in June last. I know that Urban Harvest and Kinder Institute have like a long relationship of collaborations, and we also have other programs called the Community Bridges program that helps nonprofits with interns from Rice University that come and help nonprofits to develop research projects. So that's one of the collaborations. And also Rice University has the Houston Community Data Connections dashboard that our previous program and development manager, she used to build grants and all sorts of projects around data. Another component to kind of like to build an effective or successful collaborative research project has been good communication. I mean, Katie, she's awesome at doing this. She's like very scheduled. We had regular meetings since it was a very like short turnaround. It was just like a 6 months. We had to build this data tool. We had to put together focus groups and surveys. So we really had to be kind of like very consistent with each other's emails. And I don't know, it was just like a very fast-paced project, but I feel like I know her already. We met in person around a month ago, and it was like, I feel like I've known you forever. So we got to develop like a very strong relationship. So we're just hoping to get that, to move that to the next level and build bigger projects, hopefully. We also have like established responsibilities, specific deadlines. We set that up at the beginning of a project. This collaborative project also allowed us to secure future funding. So now we're working again together. So it's kind of like whenever something starts, we do a good job. We've been able to build upon that small success, and now we're trying to kind of like grow and grow together. What else? I think another important point is it allows us to build like a very strong tool that it's comes like it's built based on like interdisciplinary approaches or like different skills or mindsets that really kind of like everything comes to play, and we're able to build a stronger kind of like a community-based tool that is really helping us to uh, to improve our decision making and like our regular internal processes on where do we go from here.
Yeah,
What
I'll add to
else?
that, Paula. For us, I think what everything you just said is really accurate. Like, we had a pre-existing relationship with Urban Harvest that made us a lot more comfortable entering into this kind of collaboration with them, because we knew that they were committed to building their internal capacity for using data to inform their programs. So for us, selecting a partnership, that was of utmost importance. It was imperative that we knew that our collaborator could actually use the data tool in an effective way and maintain it as well. And so that was another piece, was sort of the user design for the data tool. We had lots and lots of in-depth conversations about what kind of data was important, how they wanted to use the tool, that helped inform how we ultimately designed the interface and the layers in a way that would be really user-friendly, not just by Paula, who is kind of the data person at Urban Harvest for the time being, but also by her other colleagues in the food access program.
So yeah, the collaborative process has been kind of like these two organizations, but also within each organization to bring those people and kind of like connect them all at the same level. So it's been a journey, but definitely a good one.
Yeah, and what about for you all, Cleveland? Was this a pre-existing relationship? Was this something that was built out over the past year? What did that collaboration look like?
Debbie, you want to take that one?
Sure. Yes, and this has been a collaborative partnership really for probably about 20 years, probably longer than that too. So we have been, we have just developed, I think, a really good working relationship, and there's just sort of a kind of a rhythm that goes along with this. We do this work quarterly in providing data to CASE. But what we have found over this past year was that it was challenging to figure out how to communicate with providers effectively, because certainly our organization was working remotely, and then just staying in touch with the early care and education programs that were still open. We really had to kind of rethink how we do that. But I think that we really kind of came up with a good workaround for that with our staff, and utilizing all of our staff to really reach out and not just gather their enrollment and their capacity data, but also to provide those early care and education providers with other questions and resources where we could, to really support them in their work, because it was so critical at this point for folks that were first line responders and some service workers that or essential service workers that needed to continue to work. So that was a part of that was our process to provide that data to CASE, but CASE was able to take it to another level in looking at some other layers of data. And so I'll let you respond maybe from there, Rob.
Yeah, I would just, I'd add that, you know, it's we do have a long relationship with Starting Point and other partners. If we had been left to our own devices, we could have fashioned a big report. It would have been very cool and And we might have gone back to starting point at the end and said, hey, look what we did here. Aren't these interesting data? Do you think you could use them? In this process, it was much more meeting about what we want from the data prospectively. What do we want from that story map? What do we want it to be able to do? How can you use it? And so it really challenged us as more academic researchers to pay attention to practice perspectives and how that makes for a stronger product than we might have done if we had just if this had just been a more traditional funding opportunity. And I do want to acknowledge that, Starting Point, when we submitted, responded to this, the founding executive director, Billy Osborne Fears, was the person I originally contacted, and she unfortunately died after this award was announced. And so when I went to Debbie and said, look, I understand things are really complicated now. She stepped in as an interim executive director. I fully expected them to say, you know what, we've got enough on our plate. We don't need to deal with this study. But they have developed such an interest in learning from data. They kind of doubled down and said, no, we really want to do this. And it made it that much more successful. So thank you, Debbie.
You're welcome, Rob. Our pleasure.
And so this is a little bit more directed at Urban Harvest and Starting Point, and you've touched upon it a little bit. But could you speak a little bit more to kind of how you would characterize your organization's data culture kind of prior to the grant, and whether that changed throughout the course of the grant, or just generally how you were and are applying data? We can kick it back to Cleveland to start off here.
Yeah, I can speak to that. I think it will be helpful for me to have a slide that is, there you go. So that's kind of like a picture of our, I don't know if you can see it, but it's how we imagine our data-driven journey since we started back in 1994. It's been a windy road for sure, of just like a lot of information. So we started, it was a community grassroots organization, and we were just doing our thing and helping gardens to become sustainable, or just like starting farmers markets, but there was not a culture of data. Like we didn't, and this is a story that I heard, and I wasn't there when we started, but it was like, it wasn't a thing. Like it wasn't a priority. Data was complicated. Data was like not necessary. We just need to help people. So, but over time, they realized that if they didn't have data, that was not effective to our efforts. So they started taking it more seriously. And I think the big change came in 2018 when we hired a consulting company to develop a strategic plan. And in collaboration with Rice University, we got to have one intern that became our first programs and development manager. So she was actually the person that started all this like program evaluation / data collection, more kind of like more standardized. So we've come a long way. I think important things to mention is just like, we need to have quick wins. We need to be able to communicate data in an effective, visually attractive way. People is just like surrounded by newsletters and just like overwhelming sources of information. So the prettier or the more simple, the better. And we're usually always trying to kind of like find a way to do that. And one specific action that hopefully will take us to a different level is we recently had hosted a data-driven food systems roundtable, where we brought people from other nonprofit organizations and research academic institutions and even businesses thinking about data. And we brought them all together with like 20 plus people, and we just talked about data. We have a new online mapping tool that it will be published soon. And my supervisor talked about kind of like this journey in more depth. I got to show our data tool that we built in in collaboration with Rice University. And it was just like a great opportunity to kind of like say, okay, let's move to like what now? How can we be more efficient? Like everyone together, like how can we centralize data to be more efficient and provide a better experience to our target population? So that's kind of where we are now.
Great, thank you. And what about in Cleveland? How would you characterize your data culture at Starting Point prior to and throughout the course of the grant?
Thanks, Faye. I would say we've had a fairly, I think, strong and committed data culture at Starting Point. I mean, our work, and I think that speaks to our 20+ years of work with CASE around childcare data. So this just really, I think COVID brought challenges to us, but I also think it gave us an opportunity to really rethink some processes as we move forward in working with the early care and education provider community. And it just took it. I think it also enabled us to look at the data a little bit deeper in the way that we really do like to look at childcare capacity enrollment by specific neighborhoods too, and where the greatest need is. And CASE has just been an amazing partner in being able to allow us to do that with their research component and access to other data. So I think this is really, this experience has really, I think, enriched that relationship. And I know for us moving forward, this has become sort of a baseline for us as things begin to open up. As we move hopefully out of this pandemic period where we see businesses going back to work. So the service industry is really beginning to open up. So it's anybody's guess, but this will be very, very critical information for us moving forward.
Yeah, I just add on that, I think of Starting Point, because we have worked together for 20 years. I think of the long arc of the investments they have made in their data capacity internally and their data culture. And in truth, the reason we nominated them was because they were strong. That wasn't always the case. They've really come a long way in those 2 decades, but now they're strong. We nominated them because we thought they could really be a really full-fledged partner with this project. And what the big difference for me was every other data relationship that we have that involves Starting Point, it's often research that is being done to Starting Point. Somebody else is paying for it, and Starting Point is providing data, and they're being evaluated. This was the first time where Starting Point was in the driver's seat of the study. They were the lead grantee. They had the reins much more so than any other. And I think I think that really changed the dynamic in a really great way.
Mm-hmm. Yeah. Well, and so in terms of the kind of the tools that you all created through this project, so the story map, the urban harvest tool, could you speak a little bit? And I know this is, there's been some back and forth in the chat about this, but kind of how are you using them? Who is using them? Are there any next steps, any kind of next iterations for those tools?
Who goes first? Would you?
Oh, you got it. Let's go to Houston.
Okay. So I can speak for Urban Harvest. So this data tool has been like a game changer for us. So now I use it mostly on a daily basis, and our food access team uses, we use it together at least every week or every other week. So I'll give you a couple examples with, So now with our mobile market, we're trying to decide in which other areas we should be reaching out. So this data tool allowed us also to secure funding with health organizations. So now they want us to expand. Okay, so how can we decide where to go? So we've been looking at this map to see where is the most need regarding percentage of transportation or of individuals that have access to transportation, percentage of SNAP enrollment, and then, for example, there was a meeting the other day with our executive director, and we were deciding on where to invest our marketing funding from one of our grants into banners or just like this big billboards that you put on highways. And I was like, okay, let's look at the map and think strategically. So we were looking at this together, and we could overlap the percentage of SNAP enrollment with the percentage of poverty. And that's how we found out where were the best areas. So we've been also looking at potential school partnerships within our priority neighborhoods. We have, so one thing that Katie also mentioned is like how to keep this data up to date. With help from interns at Rice University, we were able to upload new layers, including Urban Harvest, what we call infrastructure, like all of our layers, like our community gardens, our school partners, our farmers markets, double up sites, and we've been able to keep it up to date. So that's kind of like other activities that I'm taking care of now until we have a new intern. But so we're also kind of like building capacity outside Urban Harvest. Interns love to learn about ArcGIS, and for us it's a great way to keep our layers up to date. And one last thing that I just love to mention is like, I didn't know that our mobile market manager, his minor in college was ArcGIS. So I almost freaked out when I found out, because I was like, this is amazing. So I didn't have to teach him. So that was great. And he was like, yeah, I took a look at the map, and I was kind of like clicking things. And do you want to see my thesis project? So I don't know. I feel like we're going to keep building this tool, kind of like improving it, and see what other questions can we answer with this tool. And that's all I have.
Well, maybe Debbie would want to say something, but what I would say about the story map is that we kind of want to see, we know that it is loved by specific power users, both at Starting Point and other kind of intermediary organizations and funders. They've already given us feedback, but our real dream was that this would actually be used also by program operators, those who run childcare programs, to better understand the context in which they serve. So we're going to have to find a way to collect some feedback from that secondary level. And frankly, I think the question will be, is it worth it? And Elena definitely bared the brunt more than me on this, but this took different kinds of work to make it happen. Mm-hmm. It would be easier to do the second time, but the story map definitely has some limitations to it that we weren't used to, technical limitations in how you can present things. We'd have to think through, if people really love it, we would definitely do it again. So we love having it as an example of a way to disseminate data in a different way. We just don't know yet whether the appetite is there in the community to make it worth it. Debbie, I don't know if you would cite anything else from the use side, and whether you'd like to have another story map down the road.
Oh, I would love to have another story map down the road, Rob, but I hear you. This was, I know a lot of technology went into creating this, formatting. But I think it's a very useful tool. I know we at Starting Point will be using this as we move forward. We have pushed this out to the early care and education community. So we will be looking at how we begin to track some feedback from them to inform how we might, or and if we might have the opportunity to do this again in the future sometime.
Elena, I see there was a question about some of the technical limitations in the chat. Do you want to say something about some of the couple of things that we encountered?
Yeah, I think one of the biggest things we encountered is that a story map, like the name suggests, it's very narrative focused. And so if you're looking at ArcGIS in general, you can have a lot of layers, like in the urban harvests maps. And it's really nice because you can let the user toggle on and off these layers, and they can really analyze for themselves the data. But in a story map, you're really crafting a narrative for people to read and digest. So we really struggle with that format of what specifically are we trying to present, and how can we craft a narrative around a select set of visuals. And then just technically speaking, Story Maps is a constantly evolving software that has some issues, some glitches, and that they're evaluating and working on. And so we kind of came up to the limitations of what they could provide us. And then hopefully as it expands, things will be easier to map. And we were not experienced at all in doing this prior.
So
Oh yeah,
go ahead.
I'm just responding to that. We are just using the story map tool, not the experience builder.
I'm going to kind of bring in a couple of the other questions from the chat and kind of combine them into one bigger question. But keep the questions coming in the chat, and after this, we'll pass it back to you all for more questions. But could you speak to a little bit how your data systems or your organizations, whether you're interacting with local, state, federal level policy advocacy, and that could be in the areas of food insecurity and childcare respectively, or it could also be kind of in issues related to digital access, equity, or local data.
So I can start from Urban Harvest because we are not we're not doing anything related to policy work. Like the data that we're doing is basically to just respond to the community needs. And basically that's kind of like the end. But we want to, it's just like in our day-to-day, we haven't found an opportunity to connect. We did receive a funding from the Harris County Healthy Food Financing Initiative that hopefully will open the doors to have a conversation at all with the government. So we're looking forward to that opportunity. But our partners, we work with the Sustainable Food Center in Austin. Through them, we're able to kind of like support policy work in some capacity. But in our day-to-day work, there's not a whole lot we're doing about it. But I don't know, Katie, if you have something to add.
No, that's it for me. I was going to say SFC, the Sustainable Food Center in Austin, is the one that sort of launched the Double Up program for Texas. Correct me if I'm wrong, Paula.
Yep.
But so they sort of led the charge for the SNAP incentive program and have since helped other cities, I think San Antonio, Houston, a handful of others, implement like local Double Up programs.
Mm-hmm.
I mean, in Cleveland, I'll just say that our advisory group included entities that are extremely active in advocating, particularly at the state level, around childcare decisions. But I think during this time, I know, Debbie, correct me if I'm wrong, but there was a big focus on what was going to happen, as far as this kind of sweetened per diem rate. Were they going to allow centers to continue to operate at limited capacity and draw down those funds, or were they going to have to, because many of these programs they have to balance their books, they have staff to pay, and the only way they could cover their costs would be to increase their capacity at a lower rate. So they were facing that. And then also the issue of having childcare workers designated as as essential and priority workers to get the vaccine when the time came. I know that was a big lobbying effort. Debbie?
Yeah, that, no, you are correct in
Okay.
that, Rob. We do have a very strong relationship with our community partners that do a lot of that advocacy work. So we do feed some of that data to them as they are working with other officials too. So absolutely. And I see that work continuing as we're moving forward.
Another thing, Paula, that I felt might relate somewhat to this question is y'all's benefit enrollment endeavors.
Yeah, so that's definitely so we're being certified. We are already certified, but we're being trained. Like our staff is being trained to be able to offer community benefits enrollment. Through our mobile market, we're visiting hard to reach areas or areas with low percentage of SNAP enrollment but high percentage of poverty to find to engage communities or individuals to enroll in SNAP or WIC or TAMF or any other community benefit enrollment. The process is the same. So we're also, thanks to this data tool that opened the door to more funding, to use data to kind of like increase those percentage or to just like enroll more people. So it's not necessarily food policy work, but as long as we're collecting data, at some point we'll be able to inform our leaders in a evidence-based, or I don't know, just like in a way that they believe that what we're talking about and they want to help us or just like make changes. So yes, we're building towards that opportunity. Not there yet.
I'm gonna hop in here and just kind of, we're right at 3:59. So I want to thank all of our panelists. This has been so helpful, so interesting. And thank you all for joining us. Yeah, feel free to reach out if you have any questions. And thanks again and have a good day, everyone.
Thank you.
Thank you.